In this video, we're going to talk about toenail fungus. Maybe you've noticed your toenails looking yellow, thick, or brittle and wondered what's going on. You're definitely not alone. Millions of people deal with this. So let's break it down. What toenail fungus actually is, how people get it, and what you can do to treat and prevent it. So what exactly is toenail fungus? It's a fungal infection that gets into the nail bed, making your toenails thick, brittle, and discolored. Doctors call it onychomycosis. There are actually a few different types. The most common is distal subungual, which starts at the tip of the nail and works its way in. White superficial fungus looks like chalky white patches on top of the nail, and less commonly, it can even start under the nail or around the cuticle. Knowing the type helps doctors choose the right treatment. Here is how it develops. Fungus loves warm, damp places. Sweaty shoes, gym showers, or locker rooms are perfect breeding grounds. It usually sneaks in through small cracks in your nail or skin and starts growing underneath the nail plate. The problem is toenails grow slowly and don't get much blood flow, so treatments take longer to work. That's why toenail fungus can stick around for months, even a year or more, if it's not treated properly. So where does the fungus come from? The main culprits are called dermatophytes, the same fungi that cause athlete's foot and jock itch. Yeasts and molds can also infect the nail, but dermatophytes are by far the most common. If you already have athlete's foot, that infection can actually spread into your toenails. And once it's in your nails, it can spread back to your skin, so both need to be treated to fully get rid of it. Some people are just more likely to get toenail fungus. Older adults are at higher risk because nails grow slower and thicker with age, which makes them easier targets for infection. People with diabetes or poor circulation are also more vulnerable, since their bodies have a harder time fighting off infections in the feet. Even small injuries, like stubbing your toe or trimming nails too short, can give fungus an easy entry point. And if it runs in your family, genetics may play a role too. So how do you know if you've got it? Look for nails that turn yellow, white, or even brown. They often become thick and brittle, sometimes crumbling at the edges. In more advanced cases, the nail might even lift away from the nail bed. Some people notice a foul odor, and if the infection gets worse, it can start causing pain or discomfort when wearing shoes. Treating toenail fungus takes time, but the most effective option for moderate to severe infections is oral antifungal medication, prescribed by a doctor. These medicines work from the inside out and have the highest success rate compared to other treatments. Topical antifungal creams or medicated nail lacquers can help in mild cases, but because they don't penetrate the nail very well, they're usually less effective on their own. They're often combined with oral treatment for better results. Laser therapy is another option, but it's expensive and results are mixed. And in severe cases where the nail is badly damaged, a doctor may recommend removing part or all of the nail so a healthy one can regrow. The best way to deal with toenail fungus is to avoid getting it in the first place. Keep your feet clean and dry, especially between the toes. Wear breathable shoes and moisture-wicking socks, and if your feet sweat a lot, change socks during the day or use antifungal powder inside your shoes. Never share nail clippers or footwear, and disinfect your clippers after trimming your nails. And finally, avoid walking barefoot in public showers, gyms, or pools. Those are hotspots for fungus. So here's the bottom line. Toenail fungus is very common, but it is treatable. The earlier you act, the better your chances of clearing it up. Medical treatments are usually the most effective, but natural remedies can play a supportive role. And above all, consistency is what makes the difference. If you'd like to learn more about your own nail health, we've included a quick nail health quiz in the description. It only takes a minute and can help you see if a supplement might be a good fit for you.